Hello everyone. This presentation is on Jing, also called Stabilize the Menses pill. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Jing belongs to the category stabilize and bind. A representative pattern is uterine bleeding from deficiency heat with prolonged or heavy periods. Important ingredients include Baizhu, Shanyao, Huangqin, Baishao, Hypioxio, Qianxi. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 42-year-old woman with prolonged uterine bleeding pattern after gynecologic evaluation. The current medicines are warfarin, levothyroxine, metformin. This case gives a possible reason to consider Jing, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Hypioxio plus levothyroxine. The mechanism is that cuttle bone is mineral-rich and may bind oral medicines, decreasing absorption. The clinical significance is clinically relevant for levothyroxine. My management plan is separate levothyroxine and the formula by several hours. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Baishao/Huangqin plus warfarin. The mechanism is that, although evidence is limited, any formula used in a bleeding disorder patient taking warfarin deserves close review. The clinical significance is moderate because the patient already has a bleeding presentation. My management plan is monitor INR and bleeding symptoms closely. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is metformin plus reduced intake. The mechanism is that, if bleeding and fatigue reduce food intake, glucose-lowering therapy may need more attention. The clinical significance is moderate practical risk. My management plan is encourage glucose monitoring and physician follow-up for significant bleeding. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Jing may be reasonable when the patient truly matches the pattern uterine bleeding from deficiency heat with prolonged or heavy periods. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.